If you know anything about POTS, you probably know that it can be very debilitating and hard to treat. So I wanted to share a case series I found the other day that describes a really promising treatment for POTS symptoms. The pathophysiology of POTS is not very well understood, but we do know that symptoms seem to be related, at least in part, to dysregulated blood flow. This dysregulation is typically associated with pooling of the blood in the legs and feet, which can then make other POTS symptoms worse. This series follows 4 patients with POTS that did not experience adequate relief of their symptoms with lifestyle changes and medications alone. All 4 patients were found to have venous reflux on an ultrasound of their veins. Venous reflux occurs when the small valves inside the veins become floppy or damaged, and then it becomes really difficult to return blood back up the leg into the heart. Each patient in this series underwent a minimally invasive procedure called radiofrequency ablation. During this procedure, the doctor places a small catheter inside the vein of interest. Then they apply a controlled radiofrequency heat, which causes the vein to collapse and close. The blood flow is then naturally diverted or shunted into other nearby veins that have working valves, which helps restore venous blood flow in that area. All 4 patients responded very well to this procedure and experienced significant improvement in their POTS symptoms and overall quality of life. It's important to note that this case series is vulnerable to placebo bias and it only has an N of 4, so it certainly has its limitations. But it does make sense on a physiologic basis. And given that treatments for POTS are often limited or not well tolerated, I think this is an important avenue to explore, especially in patients that don't see improvement with the non-invasive therapies. Follow for more and check out the link in my bio to work with me one-on-one.